This is a question which is quite far-ranging, and it's obviously of great importance to patients and to physicians undergoing CAR T-cell therapy. Essentially, the sort of banner headlines are that the acute severe toxicities of cytokine release therapy are known and documented. On the Eliana study, 50% of patients went to ITU, and 50% of patients had severe CRS. And there was a 10 to 15% rate of severe neurotoxicity, and an equivalent amount of patients also required things like hemodialysis or mechanical ventilation. So it's clear that there is an instance of acute severe toxicity with cytokine release syndrome, but the real world data of application of the same therapy in a real world setting have demonstrated that with effective bridging strategies and reducing the disease burden, we're finding that the rates of severe cytokine release syndrome, and as a result of this, the rates of severe neurotoxicity are much lower than the pivotal study. And that's really impressive, considering that the real world data often is worse than seen on pivotal studies. So that's very encouraging. In terms of this is a relatively novel therapeutic, and have there been unanticipated side effects from either the pivotal study or from the registry cohorts that are being reported in a real world setting? And I think overall there hasn't been any significant instance of unanticipated toxicities noted. We do see hypogammaglobulinemia and B-cell aplasia on a persisting basis, which also supports whether or not the CAR T cells are persisting or not in this cohort of patients in this age range. And so about 80% of patients in the age range that I treat, in children from 0 to 12, 80% of them will become hypogammaglobulinemic following the treatment. And that's a sort of rational consequence of targeting CD19. And we do supplement these patients on a prophylactic basis with supplemental immunoglobulins. In terms of neurotoxicity, I think both with cytokine release syndrome and with neurotoxicity, we're all learning more about how to manage it, both in terms of effective supportive care and also targeted therapies such as tocilizumab, but also now incorporating siltuximab and anakinra where necessary, and our clinical trials are ongoing that will hopefully help us even more. So the overall sort of headline is that the toxicities of CAR T-cell therapy tend to be acute and severe. They can be predictable, so that we know that patients with a higher disease burden are those that are likely to have those severe acute toxicities, but they're manageable, and most patients are discharged from hospital at the end of a 2 to 4 week stay with a very good quality of life. And that's one thing to highlight, is that patients and their families often say to me that they feel that they are better following CAR T-cell therapy than they have felt since prior to the diagnosis, and sometimes that's after years and years of treatment. There are longer-term toxicities with CAR T-cell therapy. For example, particularly in patients who have severe cytokine release syndrome, we do see prolonged and severe cytopenias. But my experience of that has not been associated with a significant burden of severe infections, although infections are seen, as would be expected, in this heavily pretreated patient population. And in addition, other long-term side effects are the hypogammaglobulinemia, as I mentioned, that persists for as long as the CAR T cells persist, and that's an unknown quantity. Yeah, there are a few longer term issues to take care of, but generally the quality of life that we're seeing in our patients is very favourable after the CAR T cell therapy.